This is Dr. Pramuji with Houston Female Urology, and I want to talk to you today about urodynamics testing. That is a very specialized urological test that we perform right here in our office at Houston Female Urology. We've got a lot of experience with it, and it's a very helpful test to determine what's going on with the function of your bladder. If you are having a lot of bladder leakage, your bladder is dropping, you've got overactive bladder, then you may need to have urodynamic testing. What it is, it's a minimally invasive procedure that we do here where my nurse practitioner will insert a small catheter into your bladder and fill your bladder up with water and get some very precise measurements of bladder function. She'll have you cough, and you'll be sitting on a potty chair and you'll urinate directly into the chair, and it will measure the flow of the urine and the pressure in your bladder. It's not a painful test. It's not the most comfortable thing to have a small catheter, but it is very small. It's kind of an awkward test, I tell patients, because you're kind of sitting up on the examination chair, and she'll step out when it's time for you to go to the bathroom, but it still feels kind of weird. So just kind of get mentally prepared for the test. Before the test, we're going to have you do a bladder diary where you'll measure everything that you drink and every time that you go to the bathroom. And then when you come in, we want your bladder to be pretty full, because we're going to measure the rate of flow of your urine right off the bat when you're flow before we put a catheter in you. And that's very helpful to see if your flow rate is normal or if it's weakened. After the test, you might have a little bit of burning initially. We're going to give you an antibiotic to prevent infection and give you a little medicine that will help with any burning, but usually it's not bad and you will be able to return to activity right away. Then we will schedule a consultation where I will interpret the study and go over the results with you and make further recommendations. So I hope that's helpful. I hope that clears up any questions you have about urodynamics, and we would love to take care of you here. Please call us or look us up on the web at HoustonFemaleUrology.com.